For younger, more active patients who are living with hip arthritis, hip resurfacing may be an option. Dr. Michael Jacobs has been on the forefront of this new technology to help reduce hip pain and return patients to their active lifestyles.
For 10 years, I thought I could heal myself, but arthritis has a way with you.
Leslie Tinios is a 52-year-old yoga teacher on the road to recovery. Just weeks ago, she had hip resurfacing surgery because of debilitating arthritis.
I was looking for somebody who could offer me a surgical option that would allow me to return to the activities that are beloved in my life.
Leslie's search led her here to Good Samaritan Hospital. For 40 years, a leader in arthritis care, joint replacement, and rehabilitation.
Her physician, Dr. Michael Jacobs, offers a surgical procedure called hip resurfacing, a good option for some younger, active patients.
The concept of hip resurfacing arose out of a desire to save as much of the patient's bone as is possible. This is a hip that has not had any surgery. As you move into a hip replacement, what essentially you do is remove the hip ball so that you're left with this situation. With the hip resurfacing, you simply prepare the top of the hip bone and put a cap on it.
Preserving bone gives patients greater options if another surgery is needed in the future.
Ready?
Paul Schaefer also chose hip resurfacing with Dr. Jacobs.
Do I stop and think twice about doing something? I don't have to anymore.
All joint surgery patients are guided from pre-op education through rehab and recovery by a healthcare team, part of Good Samaritan's JointExperience program known as JointX.
We also have former patients. They're the JointExperience volunteers. They're here on the floor in therapy, helping the patients along. We also coordinate with the family to have them name a coach, somebody that's going to be with the patient throughout the experience.
The process continues after patients go home.
I have a variety of kinds of leg exercises that'll help strengthen the muscles that will help me regain all of the strength and flexibility that I had before. I feel like I've said no to too many things for too long, and I'm ready to say yes again. I certainly expect to be teaching again in the fall with great gusto.
If you're young and experiencing hip pain, learn your options. Call for a free JointX kit to learn about Good Samaritan's JointExperience program.
This special health report has been sponsored by Good Samaritan Hospital, here for good, a proud member of MedStar Health.
Patients who have severe arthritis in both knees may be good candidates for bilateral total knee replacement surgery. Whether both knees are replaced simultaneously or during two surgeries, Dr. Michael Jacobs is committed to helping his patients return to their active quality of life.
She's healthy and active. You'd never know just 6 months ago, Jackie Green's knees were so arthritic she could barely walk.
I had a hard time getting in and out of my car. I couldn't walk stairs. I couldn't play golf.
Jackie's physician is Dr. Michael Jacobs, Chief of Orthopedics at Good Samaritan Hospital. For nearly 40 years, Good Samaritan has provided the latest treatment options for patients with knee, hip, and shoulder pain. Dr. Jacobs and Jackie decided together she was ready for double knee replacement.
The knee replacements have had tremendous long-term success. They give an excellent high-quality result that can last upwards of 15, 18, 20 years.
For patients who need knee, hip, or shoulder replacement, Good Samaritan Hospital offers JointExperience, a program that helps patients every step along the way, from diagnosis through surgery and recovery.
JointExperience is coordinated care for joint replacement surgery. It means prehab to rehab here at Good Samaritan.
Prehab readies patients physically for surgery. A special class prepares them mentally. And after surgery, patients begin rehab.
Push, push, push. Totally relax.
Although Jackie works at Good Samaritan, she did her research. She could have gone anywhere for her surgery, but chose this hospital.
It wasn't just a loyalty. It was a fact that I knew I was going to get the best care here and the best results here, and I truly felt that that's what happened.
Jackie had both knees replaced at once, not the right option for everyone. Leon Travers is planning his operations a week apart, and sometimes patients wait months in between.
Our job as physicians and part of the JointX program, which we think is very good at delineating these issues, is to educate the patients preoperatively so they can make wise decisions for what suits their needs.
For many, it all begins with a Getting a Good Diagnosis for Joint Pain seminar. This can be the first step toward a pain-free life.
I'm doing great. I've already been on the golf course. I'm able to ride a bicycle, climb stairs, and go shopping, which is wonderful to have my life back.
There are many options if you're suffering from joint pain. Call for a physician referral or to register for the next free Getting a Good Diagnosis seminar.